Hello everyone, and thank you for joining us today for a Learning and Growing webinar. Adverse Childhood Experiences Among College Students, Implications for Learning, Mood, Cognition, and Physical Health. Our presenter today is Jerrod Brown of Concordia University. My name is Sidra and I'll be your moderator today for Hawks Learning. We will have a live Q&A session after the presentation, so please enter any questions you have into the Q&A module as we go, and we'll be sure to answer them at the end. I'll now hand it over to our presenter.
Great. Well, thank you so much, and good afternoon, everyone. I hope all of you are doing well. We're going to take a deep dive into a very big topic, adverse childhood experiences. If you have any questions, type them in the chat box. If you think of questions after today's webinar presentation, or you would like a copy of my slides that I'm sharing today, feel free to shoot me an email at this email address. I do a lot of work in the area of trauma. One of the degree programs that I oversee focuses on trauma resilience and self-care strategies. If you've never heard me present for Hawks Learning, this is a copy of my brief professional biography. One of my main roles is a professor, but I do a lot of training, a lot of consultation with different groups. I do a lot of research, writing articles, going on podcasts, and one of the big areas that I focus on is related to adverse childhood experiences. These are some of my certifications and credentials, so you kind of know where I'm coming from. I do a lot of work in the area of integrated behavioral health and doing a lot more training, education around nutrition and sleep and digestive health issues. These are all things that absolutely impact college students as well. Today's focus is obviously going to be on trauma, but I am going to try to weave in some of these more integrative, holistic kinds of approaches to consider that may help college students improve overall functioning and more academic performance. Training description, I believe all of you have in advance. And then if you, again, haven't heard me present for Hawks before, I do a lot of trainings in a lot of areas. These are my main areas of expertise and focus. Trauma relates to a lot of these. I'm going to weave in some of these topics into today's training, but not all of them. But I just wanted to visually show all of you kind of where I come from, where my lens is. This is a lot of work I do in terms of my consultation work with different groups and organizations as well. So the question comes up, why should you, if you're a college professor, care about adverse childhood experiences? Why should we care about what happened to that college student early on in life? Because it is very clear from this research that higher amounts of traumas in childhood can have an adverse impact through the entire adult spectrum. The research is very clear too that college students as a whole deal with higher levels of stress, lots of trauma in their histories, not every student, of course, and a higher number of college students also have histories of adverse childhood experiences. Why do we want to care about trauma when we're teaching classes? Because trauma can impact our mood. It can rob people of their joy. It can absolutely have negative impacts on brain health and brain functioning, which can get in the way of creativity, learning, attention, memory. High levels of stress and trauma have been linked with more motivational problems, more sleep issues, more daytime fatigue, just to name a few. If you've heard me present for Hawks before, you know I've done trainings on a variety of topics that relate to threats to academic performance. And if you look at the research that has been done on this topic as it pertains to college students, there's a number of threats we need to be aware of. Obviously, today is focused on trauma, but the research is pretty clear. We have to be aware of what role and impact stress plays, sleep issues, and mental health problems. I'm going to weave all of this in to today's discussion. So if you're new to the world of adverse childhood experiences, basically what this is traumatic before the age of 18. If you're a human being and you're listening to this webinar, we're all impacted by trauma on some level. Basically, what this research has found is that the higher numbers of traumas that we experience in childhood, and if those traumas go unaddressed, untreated, unmanaged, as that person gets older, they might have more health problems, mental health challenges, more problems in school, problems with social relationships. The list goes on and on and on. This is one study of many that talks about adverse childhood experiences, maybe higher among college students compared to the general population. The first adverse childhood experiences study was published in 1998. If you go to the CDC's website, they have a very nice page dedicated to that first study. Since that first study in 1998, there have been countless studies that have looked at various aspects and dimensions of adverse childhood experiences. And there are more and more studies now being published, really looking at what role and impact does early childhood trauma have on college performance. This is one study of many that has found that this is something we need to be aware of when working in a college setting. This is another study. Basically, in a nutshell, that first study that was published on the adverse childhood experiences in 1998 it wasn't focused on college students, but what that first study found was the higher numbers of traumas that that person had in childhood, they were more likely as an adult to struggle with obesity. Most individuals that have experienced a high degree of trauma don't sleep well. They also found that the higher numbers of traumas in childhood oftentimes equated to increased risk of using tobacco, drugs, alcohol as that person got older. So if we look at this research, they have done studies on higher numbers of childhood trauma behaviors. So that's people that do not get a lot of exercise, a lot of movement. Unfortunately, a higher number of childhood traumas may increase the risk of suicide as that person gets older as well. There's a number of other factors to take into account, but those are a few you'd want to consider. Other things to think about when you study the adverse childhood experiences research, it's imperative to understand toxic stress. Toxic stress is always a bad thing. Stress can be a good thing. There can be normal types of stress, but toxic stress is always a bad thing. Toxic stress is going to be cumulative, it's going to be chronic. It reaches a point where it exceeds that person's ability to cope with that stress. Toxic stress has been linked with all kinds of physical health issues. It may play a role in heart disease. It could increase the risk of certain kinds of cancers, kidney related problems, diabetes. The list goes on and on and on. So, if you've ever worked with a student that is going through a high degree of toxic stress currently or in childhood, that would indicate to you that that stress has been going on for a long time and it's exceeded that person's ability to cope effectively with toxic stress. May be more likely to turn to drugs and alcohol in some cases. They may be more likely to engage in emotional eating. It's not uncommon for individuals with these histories to have some challenges or some problematic relationships with food, fast food, excessive sugar consumption. The list goes on and on and on. So, in a nutshell, if you look at the adverse childhood experiences research, if that person had experiences of any kind of abuse in childhood, that would be considered an adverse childhood experience. If that college student grew up in a home and they were exposed to a lot of chaos, household dysfunction, they witnessed domestic violence, one or both of their caregivers had a serious mental health problem, a drug and alcohol issue, or if they had a caregiver who was incarcerated, these would all be things that would constitute a type of adverse childhood experience. And basically, what this research has found is that the more of these exposures someone had before the age of 18, increased likelihood when they become older, they will have more mental health and physical health challenges, just to name a few. So remember, the first ACEs study published in 1998, they focused on these domains and a few others. Since that time, there have been, again, countless studies that have looked at other dimensions of adverse childhood experiences, and these are a few. So let's break this down a little bit. Maybe you were working with a college student who was entered into the child welfare or child protective services before the age of 18. Did that college student grow up in poverty or homeless situations, or did they live in a neighborhood where there's a lot of community violence? These would all constitute now a type of adverse childhood experience. A few studies have actually looked at too if a child grew up in a home and one of the parents had a really serious gambling problem. This is not an all encompassing list, but these are several variables you'd want to consider when we look at this through this lens. How does COVID-19 factor into this? That have been published in the past few years that are really questioning children who grew up during the era of COVID-19. Should that constitute an adverse childhood experience in and of itself? You will find numerous studies that really talk about COVID-19 amplifying stress, worry, fear, hardship. I've done a lot of consultation with different groups over the past few years during the era of COVID-19. And this is a topic that does come up from time to time. So we also need to consider when you're working with that college student, how did COVID-19 actually impact the individual? I've known people that have been impacted absolutely dramatically. They've lost loved ones. Other people weren't impacted that bad. So it's very important to individualize whatever you're doing with that student, knowing that for some students, COVID-19 may have been not that severe. For other students, it may have been absolutely life-changing and life-altering. When you study the adverse childhood experiences research, you also want to be aware of a term called complex trauma. Trauma is a big, big topic. There's multiple dimensions of trauma that fall under this umbrella. But complex trauma, think of it as more widespread types of trauma. It's more cumulative. It's not a one-time event. Typically, somebody who grew up in a home and they were abused or neglected over and over and over again over multiple years, that is a complex trauma. Complex trauma has been related to more brain-based problems. So that student, as they get into a K through 12 setting, might have learning disabilities. They might present as if they have ADHD. In some cases, people that have had extensive complex trauma may have more trust issues. They may have more boundary issues. They may have increased empathy deficits. Complex trauma should alert you to the fact that someone has had a lot of trauma over a long period of time. There's a lot packed into this slide. We're just going to park the brakes for a second, let everyone digest this. But this is not an all-encompassing list, but this is a pretty good list that basically shows us high levels of early childhood trauma are linked to multiple health conditions if that trauma was never treated or addressed. Just take a look at this list if anyone has any questions or thoughts. Unfortunately, too, some of this research points to the fact that people that had lots and lots of trauma earlier on in life may unfortunately pass away several years sooner than the general population. I'm just going to stop there for a second, see if we have any thoughts or questions on those first few slides, and let everyone just take a look at this slide for a second. Going once, going twice. Okay, we'll move on. When we think of this too, disparities is a huge, huge factor that we want to take into account. If you're working with a college student who has been dealing with a high level of disparities, a couple things should come to your mind. Economic disparities may be a factor. So we're talking about lower socioeconomic status, poverty, homelessness. Is there a history of racism? Is there a history of not having access to appropriate health care, having access to appropriate food, transportation issues, housing disparities, all kinds of things? Definitely things we want to take into account. So think about any kind of disparities when you're working with students. Other things to consider, you're going to find numerous studies talking about higher levels of childhood trauma may adversely impact school performance. So what this research has found, if we go back to a K through 12 setting, it's very important to kind of understand where our students came from. People that had high levels of trauma may be at an increased likelihood to be suspended or expelled from school. They might have a lower GPA. They might be assigned to special education classes. You will find plenty of studies that talk about language deficits being a factor. So as this individual goes through a K through 12 setting, if that school never detected these things, that can lead them at a complete disadvantage as they get close to graduation. And in some cases, it may prevent some of these students from even considering going to college. The individuals that do go to college, they may go to college and they may have a lower GPA. They may enter college where they're not as prepared as other students. So take that into account when you're working with students that may seem a little bit behind compared to other students. If we can look through a trauma lens, we might be in a better position to develop an intervention plan. We'll have more empathy, more compassion. We'll be able to serve these students and help them thrive through the college experience. Other things to consider. This can differ from student to student, but if you're working with students in a classroom who have had a lot of trauma early on in childhood, increased likelihood they might have more attention problems. For some of these individuals, they may have had an increased likelihood of being bullied and teased by other people. You might see more emotional regulation deficits in some of your students that have had extensive trauma histories. What that could look like would be students that are very impatient. They have a tendency to maybe interrupt people. They're very distracting. Hypervigilance would be a student that comes off as more jumpy. They're easily startled by loud noises, bright lights, things of that nature. Again, this is not an all encompassing list, but these are a few things you might want to be on the lookout if you're seeing patterns like this in the classroom. What I've really found it helpful over the years to learn about trauma because before I knew about trauma, if I saw these things, I may jump to the conclusion that that student is doing this intentionally. Now that I understand trauma, I take a step back. I stay curious. If a student may be engaging in some of these behaviors, I can have more awareness, more patience, more understanding, more empathy, and really look at it through a trauma lens. The last thing we want to do is become very reactive to a student that has a history of trauma. Unfortunately, as well, high levels of adverse childhood experiences have been linked with greater levels of skipping school, not showing up on time, not turning homework in on time. So if you are working with students that have a long-standing pattern of some of these things going on, I'm not saying every student has had an extensive trauma history, but could that be a factor, a barrier in some cases? The answer is absolutely yes, because if you look at the childhood trauma literature, it does talk about higher incidence of learning difficulties. And if that student has gone through college and has had a lot of learning problems, but no one's ever identified it that it's partially rooted in trauma, that student may present as lacking motivation. They may present as more disorganized in their thinking. They may present as more dysregulated. They may present as someone that just doesn't care about school when in fact, maybe it's unresolved trauma that's really getting in the way, which is a huge roadblock for success. Unfortunately, suicide rates as well are elevated among college students. Part of the reason, not the only reason, is extensive childhood trauma. The suicide literature is vast. We know this: social isolation, feelings of hopelessness, helplessness, chronic long term unemployment, all kinds of variables are at play. But if any of you ever study like suicide prevention, suicide risk, you would do quite well also learning about the adverse childhood experiences research. When you see this particular slide, the internalizing symptoms are going to be symptoms that student experiences inwardly: depression, anxiety, shame, self-esteem issues. Those are symptoms that sometimes can be masked in the short term. Externalizing symptoms would be more acting out behavior. So in the classroom, externalizing behavioral problems would be things that are very distracting to the entire class, which you as the professor can absolutely see quite easily. For a student who has internalizing symptoms who's sitting in a classroom, they may be withdrawn. They may not make a lot of eye contact. They may really struggle working in a group setting. They may have little panic attacks anytime they have the thought of having to present to the class. Both can be very, very challenging. And it's important to understand that people with high levels of childhood trauma, in a lot of cases, may be dealing with one or the other, or in some cases, both. Other things to consider: if you were part of that training I did recently for Hawks Learning on executive dysfunction, I would go back to your notes on that. If you weren't part of that training, I think you can find that on YouTube. I would definitely recommend checking that out because executive functioning impairments really get in the way of academic performance. Executive function is the boss of the brain, the CEO of the brain, and it really guides the bus with attention, learning, and memory. Childhood trauma can erode our executive functioning capabilities. Practically speaking, if you are working with a student who has executive function impairments, that can get in the way of time management. If you have a student that always shows up late to class, that might be an executive functioning impairment. If you have a student who's very disorganized, they have a very difficult time with planning, prioritizing, listening to your lecture and taking notes simultaneously. Those are all rooted in executive function. And if that student is dealing with executive function impairments, that is a huge barrier for success. Greater likelihood that student may not complete that class, greater likelihood that student may ask for an incomplete. Lots of things to consider. Childhood trauma has been linked with greater levels of executive function impairments. Abstract reasoning deficits, fascinating topic. I do a lot of work in this area. Why should you care about this topic? Because if your student is dealing with an abstract reasoning deficit, that student has more difficulty understanding how and why questions, connecting the dots, planning for the future, seeing the forest through the trees. Abstract reasoning deficits really get in the way of self-awareness and introspection and problem solving and decision making, just to name a few. High levels of childhood trauma have also been linked with having more abstract reasoning deficits. Practically speaking, when you're working with a student, if they're dealing with this and you are asking them to solve problems in an assignment that's really complex, that can be really, really tricky for someone that has this way of thinking. This way of thinking is basically really black and white thinking, and they have a really difficult time seeing the forest through the trees. Language skills, huge, huge topic to be aware of. Childhood trauma can have an adverse impact on language abilities. Obviously, language plays a huge role in success in day to day life. Doesn't matter what we do. I'm talking right now, that's a language skill. Working in a group, telling a joke, these are all language skills. If you're working with a student that has high levels of trauma and language deficits, that could trickle down in contributing to more listening deficits, reading difficulties, writing problems, and articulation deficits, just to name a few. Unfortunately, too, as I mentioned before, just something to point out here, and I forgot to mention at the bottom of each of my slides is my full citation. And again, send me an email if you'd like a copy of these slides. I'd be more than happy to share it with you. High levels of childhood trauma have also been linked with greater risk of using drugs or alcohol or tobacco products, even energy drink consumption, fast food consumption, and high levels of sugar consumption have been linked with higher levels of childhood trauma. When I look at this slide, what jumps out at me that's not on here is a self-control deficit on some level. Childhood trauma over a long period of time can erode that person's ability to control their impulses. So they might have reduced abilities to delay gratification. They might have higher levels of impatience. And in some cases, this could be a factor in that student turning to drugs and alcohol to cope. Just wanted to throw this out here that maybe we don't think about that much. Chronic pain issues is a real problem in the United States. People that have had a ton of trauma in childhood may be more likely to have chronic pain issues in adulthood. I'm not saying this is how it would always play out in a classroom, but if you have a student that's dealing with chronic pain issues, they might be standing up more, they might be fidgeting more, they have a hard time concentrating. It is something to be aware of. If anyone has any questions about like chronic pain and trauma in childhood and the link there, let me know. There's a lot more to this, but just know that this is another variable to take into account. Another factor, I see this often in the cases I consult on, is high levels of irritability. Irritability in some cases could be a gateway into full-blown anger, rage control problems, emotional dysregulation. If you are working with college students who have a high level of irritability and it's kind of unexplained, could it be trauma related? In some cases, yes. Not every case by any stretch, but high levels of irritability, especially over the long haul, may be linked with higher levels of childhood trauma. I see this play out. And if we can understand irritability and do things to help reduce that irritability, a great intervention strategy to help that student stay focused, help them be able to listen more, help them stay on track. It's very hard to stay on track in a course room and work in a group if you're dealing with a constant state of irritability. And anxiety probably being one of the most common mental health related issues associated with high levels of childhood trauma. I've consulted on cases where anxiety, panic attacks, agoraphobia, post-traumatic stress disorder, OCD, have been absolutely at play when we're talking about childhood trauma. If you have a student that has had tons of trauma in childhood, increased likelihood they may be dealing with a higher degree of anxiety in the course room. They may have a lot of anxiety about public speaking. If someone has a high degree of social anxiety, that's been linked with more childhood trauma and more bullying. I was bullied really bad back in fourth grade. And even today, I get anxiety about public speaking. So these are things that really stick with someone over the long haul. So I don't know what the answer is. If you have a course and you have a requirement where students have to give a presentation in front of the whole class, but just think about this. If you have a student in there, lots of trauma, tons of social anxiety, that could be an absolute trauma trigger for that student. I don't know what the answer is there, but just take that into account if you're noticing patterns with some of your students around like public speaking. Anxiety symptoms are all over the map. This could be a training in and of itself, but anxiety is a big topic. Obviously, we know anxiety is a real problem for lots and lots. COVID-19 has not helped with this. If you're a professional listening to this, you've ever dealt with burnout, anxiety is a huge symptom. This is basically what anxiety is in a nutshell. It has different dimensions. So if you're curious, there's emotional, cognitive, physical, and behavioral dimensions. But anxiety is another huge barrier that can get in the way of academic success and performance. What this would be is if your student is sitting in the class and they're dealing with sensory processing issues, bright lights, cologne, perfume, lots of commotion going on, lots of background noise, that can overwhelm the senses. And if you have a student that has their senses overwhelmed, a couple things could happen. I've seen it play out both ways. You could have something called hypo kind of irritability, where they shut down and become very lethargic, tired, fatigued. Or you could have hyper irritability, where that student becomes more loud and boisterous and maybe storms out of the classroom. Both can happen. Sensory processing issues are real. Childhood trauma can exacerbate this. A couple strategies you'd want to be aware of is look at your classroom, look at your office. If there's a lot of clutter, a lot of bright lights, if there's a lot of pictures on the wall, that can be very overwhelming for some students who have these sensory issues. Other things you want to be aware of is that childhood trauma has been linked with more social skill impairment in adulthood. This could trickle down into friendship making deficits, problems with perspective taking, difficulty working in a group setting. If you work with students that have profound social skill impairments, in some cases, that could be linked with higher levels of childhood trauma. And obviously, students go to college probably with the goal of finding employment or getting advancement in their employment. High levels of childhood trauma have also been linked with more academic and employment related problems. So if you are working on a college campus and you're trying to help students find a job, be aware that this could be a barrier as well. So it's another reason why I think it's imperative we all become trauma informed. I'll park the brakes there for a second, see if we have any thoughts, questions, concerns, anything I can clarify.
Yeah, we do have a question. Is there research to indicate any overlap with autism given the similarities in some regards?
Yeah, I've actually given several talks on autism and trauma. So what I can say is there's plenty of research that shows that people on the autism spectrum typically have higher levels of trauma compared to the general population. A lot of that trauma comes from bullying and teasing. But let's think about this too. If a child grows up, has had a lot of early childhood trauma, they could develop deficits that look a lot like autism when in fact it might not be autism. It could be trauma related. A couple things to be aware of: perspective taking deficits, empathy related problems. So, a lot of times, some of those symptoms can look very similar. So, if any of you are working with students on the autism spectrum, a couple takeaway points is most people with autism probably have had some level of trauma in childhood or in adulthood. There's a case I consulted on a few years ago. This was an adult individual on the autism spectrum who actually went to college and had a long history of being bullied and teased in high school as well as college. Whoever asked that question, shoot me an email. I can send you some links to some podcasts I've done on that very topic that will help clarify that even on a deeper level. Thank you for that.
Thank you.
Yeah.
How are we meant to know whether a student has ACEs? This must be private information.
Basically, how do we know if they've had this kind of extensive childhood trauma? Basically, what you're asking.
Yeah.
As a, like, let's say you're a college professor, you're not going to ask that student, have you had this kind of trauma? But be aware of the red flag indicators, the symptoms. If you're noticing kind of some of these patterns, I'm not saying go there and like screen the student for this, but just be aware that this student could be dealing with trauma, having more sensitivity, using a trauma informed teaching lens. Maybe in some cases, you as that professor would encourage that student to talk with the school counselor, talk with a school psychologist, where that professional could then dig deeper into that topic. If appropriate, I'm not telling anyone what to do. Obviously, talk to your administration, make sure it's in line with what you're doing. But depending on the class you're teaching, educating students about this topic can be very helpful as well. There's lots of great videos out there, and just normalizing that we all go through trauma, having some educational curriculums or classes about what is the adverse childhood experience, because plenty of research says whatever field of study you're working in, the more we can learn about this, the more we can educate others, that can actually be very healing and help people seek out supports and services to help better understand maybe why they're dealing with some of these challenges. Because for some students, they may never connected the dots that the trauma they experienced during 2, 3, 4, 5 years of age is still impacting them as a 20 or 30-year-old adult. Great questions, you guys. Keep them coming.
Thank you.
Yeah,
There
you're
is
welcome.
the issue of legal limitations in approaching students' disclosures, etc. Any suggestions on how to balance those legalities and helping students in our classroom?
Yeah, I would say just kind of what I said. I mean, being aware of the red flag indicators, maybe providing general education on these topics. And if you're noticing patterns, you're not probably going to like dig deep into their history, but asking them, maybe referring them to again to the school counselor. Again, follow all policies, procedures, confidentiality, all of these things. But the more we, at least for me personally, the more I've learned about these topics, it's helped me become more understanding, more curious, more patient, because I know the research on this and that a sizable percentage of college students have been dealing with some level of trauma. And now you throw COVID into mix. We've all dealt with this on some level. So at the very least, it's helped me be more patient and understanding. And if we can use those approaches with anyone we work with and our coworkers, I think it leads to better outcomes. Any other questions before we jump into the screening section?
We do. Um,
Okay,
does
sure.
having had significant ACEs in one's past impair the ability to recognize them in others?
Wait, can whoever typed that in, can you clarify what you mean? I'm not sure what you're asking.
So
I'm
if you've
sorry.
experienced it yourself, is it harder to recognize in other people?
Mm, it's tough to say. What I would say about that is, in some cases, people with lots and lots of trauma may have more perspective taking deficits. They could have more empathy problems, and they could have something going on called alexithymia. If you've been part of any of the trainings I've done for Hawks, you've heard me talk about that once in a while. High levels of trauma may relate to higher levels of alexithymia. And alexithymia is emotional blindness, where that person has a difficult time understanding, naming, labeling, and processing emotions. So there's a big disconnect with how they feel and how they make sense of emotions and how they connect with other people. And unfortunately, too, high levels of trauma in childhood could relate to more intimacy deficits as well in relationship conflicts. So I think in some cases, the answer would be yes, but not always 100% of the time. I better rock and roll through this next section, but I promise I'll stick around. I'll answer as many questions as possible at the end. How does mental illness factor into this? Again, high levels of childhood trauma absolutely can impact mental health, and that students' thinking may be impaired in some cases. They might have more mood regulation problems. They might have greater difficulty with interacting with other people. So it could get in the way of those social skills. It could get in the way of employment, all kinds of things we want to be aware of. Unfortunately, we know depression is elevated among college students as well as daytime fatigue. When we think about these things, If we can understand trauma, we can better understand why some students may be more prone to having higher levels of depression, higher levels of daytime fatigue. Basically, what this is here, the symptomatic burden, be aware of somatic symptoms. That could be fatigue, digestive health issues, back pain. These are all things very common among people with high levels of childhood trauma. By no means am I saying a student would always have this, but this is some research that shows that high levels of childhood trauma could contribute to greater levels of guilt, shame, anger control problems, and higher levels of self blame as that person gets older. So, if this student is dealing with a high level of shame and a high level of self blame, absolutely, without a doubt, that could get in the way of academic performance. Sleep issues, very, very, very common. If you have any interest in the topic of sleep, shoot me an email. I have multiple handouts, podcasts I've done on this. I'm a certified sleep coach. I do a lot of work in the area of sleep. Sleep is number one to health, in my opinion. Sleep plays a huge role in academic performance, and high levels of trauma, stress, fear, adversity, hardship, depression, anxiety, all have been linked with higher levels of sleep problems. There's a lot of research actually out there on sleep issues among college students, but this is in a nutshell what this research says. Why should you care about sleep related issues in college students? Because it's been linked with lower grade point averages, problems with academic failure. It can mimic learning challenges. It can impair their moods. They might have more up and down mood swings. And unfortunately, chronic sleep deprivation has been linked with an increase in all kinds of risky behaviors, including falling asleep at the wheel and having very bad outcomes happen in some cases. If we have any coaches here, or if you work with students who are on any kind of teams or athletes, plenty of research also supports the fact that chronic sleep related issues can really get in the way of academic performance, as well as high levels of trauma. This is the alexithymia I mentioned before. If any of you are interested in this topic, just Google my name. I have several articles out there and podcasts I've done on this. This is a huge topic that I don't think college professors have really ever had training on. The research really points to the fact if you are working with a college student has a high level of trauma, lots of mental health challenges going on, there's probably a likelihood that at least half those students may be dealing with alexithymia. Again, this is emotional blindness, problems making sense of emotions, naming emotions, labeling emotions. High levels of childhood trauma has also been linked with higher levels of obesity as that person gets older. There's a lot of reasons for this at the biochemical level and the behavioral level. If you have any questions about that specifically, let me know. These are a few of the variables you'd want to take into account if you are wanting to learn about this topic. Understand the impact that obesity has on college students and performance. These are some of the variables found in the college literature that may increase the risk of weight gain and obesity in some of the students you're serving. So, executive function impairments we talked about before. This is the boss of the brain, the CEO of the brain. But we also need to be aware that learning challenges and dyslexia is something we need to be aware of, especially if you're working with students that have had extensive childhood trauma histories. These are huge barriers to academic performance. As we move into interventions, I'm always a fan of using strengths-based approaches, really capitalizing on academic strengths, resilience, optimism, gratitude, focusing on that student's hobbies, their skills, their interest. We can't go wrong with focusing on strengths. In the higher education arena, understanding these topics are of great importance, not just for the students we serve, but if we can understand these topics as well, this can play a huge role in reducing burnout and helping support the staff we work with as well. Focusing on building resilience has been shown to really serve as a protective factor against lots of childhood trauma. So, if you think about resilience literature, this is really psychological strength. If we have a high degree of resilience, we're more flexible, we're more bendable, we're more adaptable. So, when something tough happens, we're able to bounce back from that. We can help process it, make sense of what happened to us, and we can thrive. Students who are resilient typically do better in the classroom. When we think of the components of a resilient student, these would be students that have better emotional awareness, higher degrees of self regulation. They typically have higher levels of social competence. They're usually more optimistic. So, students who are more resilient typically can handle tougher stuff more effectively. If we look at the adverse childhood experiences literature through a resilience lens, these are some of the variables you might want to consider if you're wanting to take your knowledge to a deeper level. If we can infuse some of these approaches and interventions into the work we do, it has been linked with improved outcomes. So we focus on positive emotionality, learning how to manage our emotions more effectively, having greater levels of empathy, focusing on ensuring the school environment feels safe to the faculty, to the students, and also focusing on community cohesion has been recommended in this literature. There are several studies that talk about the importance of infusing trauma-informed care approaches into the work we do as professors and teachers. You'll find multiple studies that talk about when you do this, it does lead to improved outcomes. If you want to become a trauma-informed educator, you can go on, I believe, YouTube and type in trauma-informed education and type in my name. You can find a podcast I did on that topic as well. I can't stress enough, if you're teaching any kind of classes, becoming a trauma-informed teacher, you can't go wrong. Even if you're not working with students who have been impacted by trauma, these interventions can be helpful for any student, regardless of status and background. So if you were to start infusing these kind of principles into the work you're doing in a classroom, these are just a few of the variables you'd want to take into account. Making sure that your environment feels safe and supportive. You want to be encouraging. You focus on empowerment. Again, those strengths-based approaches. As much as possible, predictability and structure can be very helpful when working with individuals impacted by trauma. Study after study talks about the use of these approaches can really help improve academic performance. So, at the core of becoming a trauma informed educator or a leader or a practitioner, whatever role you play, empathy is at the top of the list. Really striving to understand trauma and staying current on the trauma literature. We're going to be compassionate to the people we work with. We're going to be respectful. We're going to promote resilience. We want to promote an attitude of growth and hope. These are all things talked about in this literature. A few other things you want to consider as a trauma-informed teacher, educator, administrator. This is what the research says in a nutshell. Again, we see positives all the way down. Anytime we can promote the positives and capitalize on the good stuff, a lot of times that can help minimize the tough stuff. Other things to consider here, self-regulation. It is talked about in this literature that if we can model and teach and educate students about self-regulation, that can lead to improved outcomes. Teaching self-regulation is basically teaching students how to be more patient, to pause, to reflect, to put on the brakes, to think through their actions. Teaching self-regulation skills is imperative to overall academic success, but it's also very important in all other aspects of life as well. If you study trauma literature, you've probably heard of the topic of post-traumatic growth. This is basically helping that individual thrive after the trauma. This is basically the components of post-traumatic growth. So for some students who've experienced a really tough go at it earlier on in life, working with someone who understands post-traumatic growth can help that student thrive and heal and see the future as brighter. These are the components that maybe like a trained therapist, social worker, someone that does this kind of work would focus on maybe with a student. I'm a huge fan of positive psychology and positive psychological interventions. Doesn't matter what field you're in, if it's education, psychology, whatever field, if you understand these dynamics too, these are things that are linked with positive outcomes for educational arenas, capitalizing on enhancing self esteem. Promoting self efficacy plays a huge role in academic performance. If we can model optimism, gratitude, a mindset of joy and happiness, that can be contagious to other people in a good way. Promoting optimism is a great, great thing to utilize whatever we do. The research on optimism is many and varied. It has been linked with a reduction in mental health problems, improved academic performance. It's been shown to help improve creativity and enthusiasm. The list goes on. I'm currently working on another degree right now in applied nutrition, and I always try to weave in just a little nutrition talk into most of my trainings now. But if you have an opportunity, if any of your colleges have like horticulture programs or therapeutic gardening programs, there's plenty of research to support the fact getting students out in nature, gardening, doing these kind of things has been linked with improved mental health outcomes. Helping students feel like they matter, feel like they belong, has been associated with all kinds of benefits. Take a look at this slide. People that feel like they matter, they belong, they're included, they're known, they're heard. It's been shown to reduce loneliness, help reduce depression, anxiety. Remember the pain we spoke about before? The very nature of feeling like you belong to a group has been linked with pain reduction. It can play a role in reducing suicide risk. It can help improve cognitive functioning, some of those executive functioning capabilities we spoke about before. Practical strategies. Again, you have to determine if this is appropriate for your program, your course, but just journal writing is a great, great strategy. It can help us enhance our thinking abilities. It's been linked with so many positive benefits. Reflective journaling. I know some classes that I've taken as a student, they use these kind of strategies. I'm a major fan of journaling approaches. Reflective journaling, gratitude journaling, all kinds of types of journaling out there that has been linked with many positive health benefits. Promoting grit and gratitude among college students has been studied within the era of COVID-19. And what this research has found is that if you can help your students develop a greater sense of gratitude and a greater sense of grit, which is basically teaching students how to hang in there, be more perseverant, more confidence, this has been linked with improved academic outcomes and positive well being. Self compassion is another practical strategy that you can use with your students. If you utilize self compassion interventions, it's been linked with all kinds of positive benefits. This is a very, very small snapshot of the research on self compassion. If you're new to the world of self compassion, basically what they're standing, more self forgiveness, learning how to let things go. If we make a mistake, we don't think we're a bad person. Maybe we just made a bad decision. If we can have greater levels of self compassion as a professor, we're in a much better position to be healthier. It can improve our performance. Students that have greater levels of self compassion, it can trickle down into many positive benefits for that individual. Other things you want to consider is well being. If you are interested in the well being literature, this would be a good questionnaire. You could Google the Oxford Happiness Questionnaire, just something you can find online. Promoting well-being is basically fostering an attitude of hope, resilience. You're promoting self-efficacy. You're helping students feel like they belong. And promoting self-care, very, very important. Self-care, equally important for us as the professionals. That plays a huge role in burnout prevention. I'm not giving any medical advice today, but when I consult on cases, these are just general healthy lifestyle practices for all of us to be aware of. Again, getting better sleep. Maybe you work with a nutritionist. Staying hydrated. I see this a lot in cases I consult on. Low-grade dehydration. Exercise, again, working with a qualified healthcare specialist, managing our stress, even regulating our blood sugar levels. I do a lot of work in this area as well. Meal skipping, people that eat a lot of fast food, lots of energy drinks, they can have very poor blood sugar regulation issues, which can trickle down and impact our brain health and our mood and our energy. And digestive health. I think I'm doing a training for Hawks Learning in January on the gut brain health axis and how that impacts college students. So be on the lookout for that. Why should you care about digestive health issues? Because if someone is dealing with digestive health issues, that is an indication that their brain's not working properly. There's a connection between what goes on in the gut and the brain. It can impact our mood, our energy, our thinking. Just wanted to throw this in here. I'm not giving nutritional advice, but this is what some of the research says too. Another way to combat high levels of adverse childhood experiences is to eat healthier. Research says that. And promoting hope. Without hope, it's hard to get traction. If we can instill hope in the students we work with, that is a great avenue to help that student thrive and become more resilient and achieve their goals. So I will park the brakes. I know I threw a lot at you in a short amount of time. I will stick around as long as we need to answer any questions. And again, you have my email. Send me an email. Love to chat with you and can send you lots and lots of resources on all of these topics.
So we have a couple of questions.
You bet.
Unless a student has self-reported and has accommodations to assist, such as a note taker, extended testing time, testing in a quiet area, etc., how can I assist students? I can't have varied expectations for students depending on their possible childhood trauma and toxic stress issues.
It gets very, very tricky. And I think it really stems to the point we're not trained in these things a lot of times. I'd love to hear your guys' thoughts on this, but looking at your institution, talking to your department chair, talking to your dean, could some of these strategies be put into place more to policies and procedures level? Could you get more training in this? I don't know the answer to that. Every college is different, but if you can infuse this education into the good work you're already doing and looking at your policies, your procedures, your practices, and infusing a trauma informed mindset and lens into that, the research is very, very clear. It can lead to better identification of students that may be struggling, faculty that may be struggling, and implementing the appropriate supports and services to help the faculty and the students thrive in that environment. I don't know if that answered that question directly, but that's at a bigger policy level. But again, all of you, thanks for taking your time out of today's training. Just know that this is a starting point. Take your knowledge to that next level. There's a multitude of other avenues and variables you'd want to learn about if you truly want to become more trauma informed.
Thank you. We have one last question. Theoretically, could mental health literacy be a viable intervention offered to students?
Yeah, I love that literature, and I'll take it a step further. If appropriate, looking at health literacy literature as well. Health literacy literature talks about if you can increase health literacy, people are more likely to be proactive and talk to a healthcare provider about their symptoms or a behavioral health professional about their mental health symptoms. If you can enhance the literacy around those topics as well, it has also been linked with increased likelihood that person will go to the doctor and get a routine physical, go to their dentist regularly. So I'm a major fan of that on a multitude of levels. So yes, definitely. I think that's a great avenue to go.
Thank you.
You bet.
All right, that looks like all the time we have for questions. Thank you, Jerrod, and thank you all for attending today. We will be emailing you a link to view the recording of this webinar once it's available. If you or any of your fellow instructors are interested in presenting for our Learning and Growing webinar series, please submit your proposals to the Learning and Growing website, which I'm going to link in the chat now for easy access. These free webinars are brought to you by Hawks Learning, an innovative educational courseware company. To learn more about our mastery-based course materials and how Hawks can enhance learning outcomes for you and your students, please visit hawkslearning.com, and I hope everyone has a great rest of your day. Thank you all for attending.
Thank you, everyone.